Hi, my name is Chuck Norlin. I'm a general pediatrician at the University of Utah and director of the Medical Home Portal. And I'm here to provide you with a brief history of the portal and its evolution over the last 20 years or so. It all began in 1998 when the Utah chapter of the AAP surveyed primary care clinicians asking what they would need to improve their care of children with chronic conditions. The top three responses by far were guidelines on how to provide that care, because most of those conditions are uncommon or rare, knowledge of who could help them, including subspecialists, therapists, and community-based service providers, and a care coordinator in their office. Over the next 6 months, the chapter developed and published a brochure listing those local resources, but the information in it was woefully out of date all too soon. Around the same time, published studies found that many parents of children with special healthcare needs also identified information as a key unmet need, and that though their children's primary care doctors were very important to them, many thought they didn't have the needed knowledge and expertise and also didn't offer information based on current research. In 2000, the Utah Bureau of Children's Special Healthcare Needs, University of Utah Department of Pediatrics, and Utah Family Voices applied for a medical home implementation grant offered by the Federal Maternal Child Health Bureau. We proposed that we would train 5 practices to care for children with 5 complex chronic conditions, how to coordinate their care, and to engage parents as partners in the medical home model. We said that we would use this newfangled World Wide Web to share the information, thus avoiding the problems associated with printing it. We won the grant, and the project developed its prototype website in 2001. We soon decided we needed a more distinctive design and launched this homepage later on that year. As you can tell, it lacks a fair amount of content. As we developed more and more content, we revised the design several times, and this was launched in 2003. And then in 2005, after our third try, we received an information systems grant from the National Library of Medicine to redesign the portal and its infrastructure, to expand its content, and to enable it to offer comprehensive directories of local services, not only for Utah, but also for other states. This design was launched in 2010. And you can see in the upper left corner the drop down enabling other states to be listed. And then in 2010, we received a CHIPRA Quality Demonstrations Grant to further improve the design, the navigation, and the functionality of the portal. We launched the new design in 2015, and we currently offer 7 sites, nationwide site, which lists services provided across the country, as well as provider locators for specialty clinicians, and 6 state-specific sites, for example, the Montana Medical Home Portal, using the state's abbreviation instead of www, that lists local professional and community service providers in addition to the nationwide providers. Several other grants, including additional MCHB D70 grants, as well as subscriptions from partner states, enable us to continue improving the portal. You can see here the drop down of current partners of the portal that leads to services directories and sites specific to those states. And then in 2017, we received funding from a high-tech grant to Utah Medicaid to collaborate on development of a pediatric patient summary, an app to plug into EHR such as Epic and Cerner that will summarize information from Health Information Exchange about children with chronic and/or complex conditions, and to integrate access to the medical portal's information and resources into the PPS. We are embarking soon on a redesign to optimize that integration and the portal's usability for all. We are eager to partner with other states or regions to offer the portal to your populations, and will welcome your reaching out to us with questions or interests. Feel free to contact Linnea Bauer, our Services Support Manager, Mindy Tula, the Portal Manager, or myself. Thank you very much.